Hi, my name is Lauren. I'll be doing an infant assessment. Before we start our assessment, we want to wash our hands. Sinks over here, get between the toes, underneath the fingernails. If you don't wash your hands, it's not good for the baby. You also put on gloves, so we're gonna pretend we have a box of gloves here and don on some gloves. Want to just do a quick visual on the infant. First thing you want to do is you want to set from head to toe. So we're gonna go ahead and start with the circumference of the head. We'll just take the measuring tape, lift the head gently, and measure the roundest part of the head. And we have 32 centimeters. We will take our initial vital signs. We'll take the temperature axillary until it beeps. And our baby has a temperature of 98.9 axillary, so no fever, it's within range. We'll also want to check the brachial pulses just to make sure they're nice and strong. You want to check that for about a minute, and you'll count the beats. Baby's beats are about 150, which is normal. After that, you want to listen to the heart and the lungs. So we'll listen to, you want to listen for an entire minute to get accurate heartbeats and make sure the baby does not have a murmur. So we'll just go ahead and take a listen. Everything sounds good. You also want to assess respirations. You want to watch the chest for equal rise and equal depression. Make sure everything's moving laterally. It's moving good. So you'll also want to check that for about a minute. And baby's respirations are about 52, which is within normal limits. You also want to check the height. You want to measure from the crown of the head all the way to the sole of the foot, which our baby is measuring at 18.5 inches, which is 48 centimeters. Which is good. Next, we're going to take the baby's weight, which the baby is weighing at 3.2 kilograms, which is within normal. Once we have our basic vital signs, which are good, we're going to go ahead and start with the full assessment of head to toe. So you want to measure, no, I'm sorry, not measure. You want to go ahead and feel the head. You want to check the sutures, which everything, make sure they're not overlapping, make sure there's no bleeding, no hematomas that are visible. No lax nor anything like that. So the head here looks round, equal, and symmetrical. It's easily movable from the left to the right, front and back. There's no overlapping felt. When you feel the fontanelles, you can hear, you can feel they're soft and palpable. So that's good, we want that. Movement is equal of all facial features. They're all normal. Hairline and eyelashes are present, as well as eyebrows. Eyes are bright and clear, and they're evenly placed and moving in all directions. The red reflex is present bilaterally. Pupils appear equally round. Ears and structures are in alignment with the eyes and appears normal. No pits or skin tags are noted on either side. Nostrils are patent, so there is no obvious signs of obstruction or congestion. Baby is breathing fine. Then we will stick our finger in the baby's mouth to check for the suckling reflex and make sure their formation of the tongue is good and there's no cleft palate. If there was, we would stop the assessment and let the provider know. Also, the tongue is free of moving and moves in all directions. Neck is normal. Then we would feel the clavicle. Everything seems present. There is no fractures noted to the clavicle. The sternum is midline and chest appears to be free of any type of distortion. The heart was free of murmurs when we heard earlier. The lungs were clear upon auscultation. The baby's skin appears clean and dry. The umbilical stump is also clean and dry. No masses are noted in or around the area. We would then remove the diaper and feel for the femoral pulses, make sure there is adequate blood flow to the entire body. The femoral pulses are strong bilaterally. There is no noted inguinal hernias. Now we're going to go ahead and check the labia, which there's a little bit swollen, which is good, which is normal, I'm sorry, because the baby is within the first 24 hours of birth. There is no vaginal discharge or bleeding noted at this time. Everything looks normal. The anus is patent. Since we are in this position, we'll go ahead and check the hip for hip dysplasia. So we'll go ahead and turn baby around. We'll bend at the knee joint, move diagonally in and then out to check to make sure for dysplasia. If you hear any popping or any crackling, that is not normal. You're not supposed to hear anything. This baby's assessment was negative for hip dysplasia bilaterally. We're going to go ahead and check the digits on the hands, make sure everything's normal. You want to make sure they have the lines on the palm. Make sure their fingers are symmetrical to the size of their hand, and there's horizontal lines noted on both of the palms. That's normal. After this, you want to go ahead and assess the baby's back. So you'll turn the baby, you'll assess the back just to make sure that everything, the spine's in line. You also want to make sure there is no dimple in the center. If you do see a dimple, that can be an indication of spinal bifida or any spinal problem, so you want to alert the doctor immediately. Everything looks normal on the baby. Baby is calm and awake, so then we'll go ahead and check for grasp and the muscular tone. Baby seems to be nice and strong. She is grasping. Patient is awake and calm. All extremities are moving equally. There is an equal strength in both hands, which is good. Neck control is also good. It's adequate. The muscle tone seems to be all within defined limits. The moral reflex, you want to raise the baby. Make sure the neck does not extend past 45 degrees. You'll place one hand on the back of the head. You will drop the baby, catch the head, and the arms should extend out and come back in, kind of in a motion of trying to catch their balance. Then you want to do, we already did the grasping reflex, which the baby's reflexes were strong. You want to do the rooting reflex. Make sure they are responding to in case of the hunger. So you'll just stroke the side of their cheek, and their reflex is to follow that finger and sense for a possible feeding, and they should start suckling, which is positive that they are able to latch onto the breast or a bottle. Then you want to go ahead and check for the Babinski reflex. You'll just stroke from the bottom of the foot up. In this case, the great toe should dorsiflex and the pinky toe should plantar flex. And the other 3 digits should just extend to the side. That is the response you do want to get. Anything other than that, you want to alert the doctor. You also want to check tonic neck reflex. This is, you'll turn the baby's neck from the side to one of the sides. So if you turn the baby to the left side, the left extremities will straighten out, and then the right will contract inward. And the same thing should happen on the opposite side. If that is present, we are good. Baby gestational age is 40 weeks and 2 days.